We all think we know what it means to care for someone. But what's the difference between just being nice and providing truly great care? Well, it turns out there's a professional standard, a level of excellence that honestly applies to all of us. So let's get into it. So that begs the big question, right? What does it really mean to care for someone with actual skill, with dignity, and with real compassion? We're going to find the answers by basically walking a shift in the shoes of a professional nurse aide. Their world is going to be our classroom today. All right, so first things first, the start of the shift. You might think it's all go, 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 but actually it's all about preparation. For a caregiver, these first few moments are absolutely critical for setting the tone for the entire day and honestly for stopping problems before they even have a chance to begin. And what's the number one priority? It's not about grabbing a clipboard and starting a to-do list. Nope. The very first thing a great caregiver does is check on every single resident. Just a quick, how are you? Are you comfortable? Do you need anything? It addresses those immediate basic human needs. But it's also a super smart strategy to prevent falls. Think about it. Shift changes can be chaotic, and that's exactly when accidents are most likely to happen. Now, if there's one tool that's like the North Star for the entire day, it's this, the Resident Care Plan. This isn't just a suggestion sheet. It's a legal document, a detailed roadmap that's built with the resident and their family. It covers everything. From their medical needs to how they like their coffee. And following it, yeah, it's not optional. It's the only way to make sure the care is consistent and tailored to that one unique person. Okay, so we've got our plan. Now we get into the real hands-on stuff. And this is where we're going to see a huge shift in perspective. It's not about just getting tasks done. It's about the how and the why behind every single action. Look at this. On one side, you have just a task. On the other, you have care with dignity. It's a total reframe, right? You're not just changing soiled sheets. You are actively preventing painful skin breakdown and infections. You're not just helping with a meal. You're making sure they get proper nutrition and, crucially, preventing a choking hazard. Every single thing has a much deeper purpose behind it. And this is so important. Every routine task is also a chance to observe. You're like a detective. Taking a temperature isn't just writing down a number. If you see 101.4, that's not just a number. That's a huge red flag. It's a sign of a possible infection, and it has to be reported to the nurse immediately, not at the end of your shift. That delay could be the difference between a minor issue and a serious medical emergency. Dignity isn't just about the body either. It's about respecting someone's private, spiritual life. So picture this. Your schedule says it's time to take vital signs, but you walk in and a minister is visiting with the resident. What's the right move? Simple. You quietly leave and come back later. That private, spiritual moment is way more important than sticking to a rigid schedule for a non-urgent task. All right, so let's move beyond the physical tasks because great care requires navigating something way more complex, the human mind and heart. This is especially true when it comes to communication and, things like dementia. So imagine you're with a resident and she says this to you. Now, you happen to know that her husband passed away years ago. For her, in that moment, that memory is her reality. It feels 100% real. This is something caregivers face all the time, and it can be really tough to know what to do. So, what's the right response here? Do you tell her, no, your husband is gone? Do you try to change the subject? How do you handle a situation where someone's memory and our reality just don't line up? Well, the best thing you can do is actually validate her reality. You don't argue, you don't correct, you join her where she is. A response like this, tell me about some of your husband's favorite dinners, is perfect. It shows you respect her feelings, and it gives her a chance to connect with a happy memory. Trying to force our reality on her would probably just cause anxiety and upset her. It's the same idea here. When a resident says something like this, that their days feel empty, the answer isn't just to turn on the TV or find some random busy work. The real professional response is to dig a little deeper. You ask them about their life, about things they used to love to do. Maybe they were a gardener or a painter. Finding that out helps bring those passions back into their life now, and that restores a real sense of purpose. Now, not every day is calm and predictable. Sometimes things go wrong, and in a crisis, you have to think fast, and you have to act right. Every single second counts. Okay, let's play out a scenario. You walk into a room, and the trash can is on fire. What do? Your heart is pounding, your mind is racing. Do you run for the fire extinguisher? Do you pull the fire alarm?
What is the very, very first thing you're supposed to do?
The answer is an easy-to-remember acronym, RACE, R-A-C-E. And the R always comes first. Remove the resident, get them out of danger. That is priority number one, above everything else. Then you activate the alarm, confine the fire, shut the door, and only then, if it's a small fire and you can do it safely, you try to extinguish it.
Okay, let's talk about another kind of crisis. This one is silent. You've got this number, 50 milliliters. That's the total amount of urine a resident has produced over the last 6 hours.
So to put that in perspective, a healthy person produces around 60 milliliters per hour. So yeah, 50 milliliters in 6 hours is a huge red flag. But you don't hit the panic button just yet. The first step is simple troubleshooting. You check the catheter tubing. Is it kinked? Is it blocked? It's a super common problem that you can often fix in 2 seconds. You always check for the simple fix first before you escalate.
And what about one of the most common emergencies? A fall. You walk in and find someone on the floor. Your first instinct, right, is to help them up. But that could be a terrible mistake. The rule is crystal clear. You stay with them, you comfort them, and you call for help right away. But you never try to move them. You have no idea if they've broken a bone or have a head injury, and trying to move them could make things so much worse.
So when you pull all these different moments together, the quiet, routine stuff and the high-stress emergencies, you start to see these core principles shining through. These are the things that really define what great care is all about.
Really, it all boils down to this. Safety is always number one. You're always respecting people's rights, their privacy, their choices. You treat everyone with dignity, validating their feelings. You're constantly observing and reporting anything that's out of the ordinary. And maybe most importantly, you're always trying to promote their independence, encouraging them to do what they can for themselves. These aren't just job requirements. They're basically just principles for being a good human.
And that kind of brings us to the big takeaway here. We've spent this time looking at what professional care looks like, right? But the real question is for us. How can taking these same ideas, safety, dignity, observation, promoting independence, how can that change the way we care for people in our own lives? Our parents, our friends, our kids? It's something worth thinking about, for sure.